Hello, so in this video today I plan to go over verifying the 11 rights, which is something that ensures accuracy when giving medications to a patient, and how to just a little bit about recording medications. So of course, when it comes to the 11 rights, you're going to want to make sure that you have the right medication. That is obviously very important because you don't want to give a patient a medication that is not going to be safe for them. So in that case, that's kind of part of why you would do the 3 checks, just to make sure that, and just looking up the medication beforehand. That's why you would want to do that, and you want to make sure that you have the right patient. That's why you're looking at their ID band, you're verifying the 3 checks with them, just them stating their name, date of birth, and then scanning that in on their ID band. You want to make sure that you have the right dosage and that you're giving it in the right form. If it was ordered, in a tablet, you wouldn't want to give it, you wouldn't want them to have it in the wrong form, like by a cream, by a topical cream, or anything like that. You would want to make sure that, or give it IV if that's not what they need. So you want to make sure that that you're giving it in the right form, and through the right route. And you're going to want to make sure you're giving it to them at the right time, and for the right reason. Make sure that it's, that you're giving it, that you check in the system and make sure that you're giving it for the right reason. And with a lot of different, with some blood pressure medications or heart medications, there's certain vitals that you need to check first. So you always want to do the appropriate assessments first. And you're going to want to make sure that you have that assessment data, and you want to make sure that you're using the correct documentation, which is usually going to be, you're going to want to include like when you record, like your date, time, the site used. So you always want to make sure that, depending on what you're doing, that you have that correct documentation. And then the last thing that you're going to want to do is you're going to want to monitor their response after you give the medication. And you're always going to want to include the education for them. They should be informed about this medication that you're giving them. And just giving them certain things. Like I saw at clinical, a lot of the nurses would, give them, print out a little handout, and they'd give it to the patient and just say, hi, this is just some information about your medication. Sometimes they already know about it. They've been taking it for 15 years or whatever, but it's still, it can be very helpful to give that to the medication. Another thing you're going to want to explain to your patient is, that they have the legal right to refuse that medication. You would obviously want to document why they refused, and you would want to let the healthcare provider know, but they do have that right. And as the nurse, if Mr. Yoshi here said, no, I don't want that, I can't try to force him. All I can do as the nurse is educate and give him educational material, and tell him, what I know about the medication, so that he's informed. After I was done giving Mr. Yoshi his medication, I would want to record right away in the EMR, in whatever required format the hospital requires. It usually is going to include the date, the time, the site. Sometimes when you scan the barcode, that will do that for you. But you're going to want to try to do this immediately.